Now we're going to explore the concept of distributive shock. So what is distributive shock? So distributive shock is usually a vascular related issue. So distributive shock is now we're taking the distribution of our blood and now we've expanded it. So this goes back to the vasodilation aspect of it. So in a few things that may cause distributive shock or anything that's impeding the distribution of blood through the vascular space. So we have distributive shock associated with anaphylaxis. So anaphylaxis is a severe allergic reaction. And what happens with severe allergic reactions is after a histamine release, our body's way of trying to protect the body and to correct whatever antigen was or anything that's affecting and causing the allergen, our body has an overstimulation of, our body's response is overstimulated. With that is, part of that is histamine, and histamine causes vasodilation. So in severe allergic reactions, anaphylaxis, when we have blood pressure issues, our body sends out this histamine response, and a histamine response tells our body to vasodilate. Now, usually you do want that if it's a localized issue. So if somebody gets stung in their hand, yes, it's going to get swollen and stuff. In this case, it's system-wide. So our body has an over-exaggerated response to the allergen. So when that happens, our body's not just telling our local spot to vasodilate so we can go in and try to take care of the allergen. It's system-wide. When it's system-wide, we vasodilate. So now we're taking a vessel size that should be this way, and this is what our body's compensating for. Now we've increased that container size. So when you increase that container size, you lose vascular resistance. So we haven't lost blood. It's not a pumping problem. In this case, it's a container problem or a popping problem. So when we've increased our container space, then we lose vascular resistance. In the case of this, so if I have these two cups here, and this is our normal vascular space with adequate blood volume, and now our body suffers, for whatever reason, a distributive form of shock, whether it's anaphylaxis or something else. So now we have this amount of blood, and now we've opened up our container space, and now we're trying to pump the same amount of blood through a larger vascular space. So you can imagine what's going to happen. We don't have any more resistance here because our vessels have opened up and vasodilated, so we lose vascular resistance. When you lose vascular resistance, you lose the pressure the heart's having to pump against, then it causes a decrease in blood pressure. Now, it's not just anaphylaxis that can cause this. There are other conditions, and one of those is sepsis. So if you have a septic shock patient, it's kind of the same mechanism there. So our body vasodilates because it's trying to fight the infection. And there's other more molecular things going on, but in system terms, simple terms, our body's trying to fight the infection, and we have lactic acid buildup from lack of perfusion. So we have a lack of perfusion from a vasodilation because our cells can't get perfused, and we have a buildup of lactic acid and other waste products, and then that causes a cascading effect. So we have sepsis, and we also have anaphylaxis, and another form is neurogenic or spinal shock. So with neurogenic shock, our body loses our connection from a nervous system to our muscles, specifically the muscles in our arterial system. So remember, in our arterial system, we have the tunica intima, tunica media, and tunica externa. In the tunica media, the meaty portion of the vein, the muscle layer, and that's constantly contracting or dilating based off of what our blood pressure is. So if we lose communication from our brain or spinal cord to a certain area of the body, and it's going to regulate those vascular tones, if we lose communication, then basically our vessels become paralyzed and they relax. So when that relaxes, now we're have opened up that container space. When you open up that container space, you haven't increased volume, we haven't lost volume, but we have increased container space. So when that happens, you drop a blood pressure.